Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I will be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing today?
I'm doing great, thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute's Global Health Facebook page. Today, Dr. Murphy will be addressing the latest headlines and U.S. COVID statistics through today, January 26th. We invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting today with the updated COVID statistics for the U.S. Average new hospitalizations per day are 4,688. In 2023, the same week, we saw 5,373. Average COVID deaths per day, 242. In 2023, same week, 552. New vaccine uptake for adults, 21.5%. Among those 65 plus, 40.9%. And among children, 11%. Dr. Murphy, your reactions to those numbers?
Well, the numbers this year in overall hospitalizations is getting very close to the same as it was a year ago. So it's not dramatically lower. So that tells us, I think, that we're going to see these peaks every year. And I think the only difference will be how severe the disease will, because based on how much immunity there is in the population, either from vaccination or from having COVID. The number of deaths per day is also really jumped up there at 242 versus 552 last year. So that is, of course, much better than last year, but still 242 people per day dying from COVID. It's very unfortunate. And then the vaccine uptake is better, but still kind of lagging. But in those most at risk, over 65, it's up to 41%. So that is better than it was just a month ago. And children lags significantly behind at 11%. So anyway, we're doing pretty good. Compared to the flu, though, it's not so good. And remember, COVID is actually worse than the flu. So for flu, the adults, it's about 47% vaccinated and 73% over 65. So much more uptake in the flu vaccine department. And for kids, it's 47.5%. So that's pretty good, almost half. So, if we need to do better if we want to try to get a handle on these respiratory winter pathogens.
Absolutely. And there was some very surprising news from two states, one a little bit earlier than now, but one very recently, about some new rules that are breaking from some CDC COVID guidelines. Could you explain that situation to us?
Yeah, this is California and Oregon have have stated new isolation guidelines, which stray a little bit from the CDC guidelines. Now, states can do this. The CDC only can provide guidance. They can't force anybody to do anything. And so they're breaking with it. And what they're saying is people who've had COVID, who don't have any symptoms, can go back to school and work, as long as they're not coughing and showing signs of illness. So this goes against that 10-day rule and the 5-day rule, where you have to wear a mask, 5 days complete isolation and 10 days with a mask. So a lot of people have very mild symptoms and they're good after 2 or 3 days. And they're saying now that these people can go back to work. They should wear a mask, of course, but they don't have to stay out of school or stay out of work. And so that's different. It's loosening things up a little bit. They still advise people to mask indoors while in public and stay away, at least for the 10 days, like the old isolation method, from anybody who's at high risk. an elderly person or somebody with an underlying disease, they should stay away from those people. So that part hasn't really changed, but it's just things loosening up a little bit as we learn more and more about this pandemic.
Absolutely. And moving on, there are two stories here, but we'll try to break them up. Some very, very important and interesting research that came out. First is that a study between 3 or more doses of the COVID vaccine in pregnant women versus just 2 vaccines in a pregnant woman for COVID. And second is the general likelihood of developing some respiratory distress within the infant if the mother has COVID during pregnancy. Lots of words there. Can you please break those stories down?
So in other words, they're looking at, pregnant women have a hard time with COVID, as they do with many other diseases, and that's why they really need to be up to date with their vaccines. And the big question is, and what this is answering, I think, is the original 2 vaccines doses, is that good enough, or do you need at least one booster, one or more boosters? And what they showed in this study, so they had 220 pregnant women, and they had looked at all the birth outcomes and whatever, and they looked at the concentration of the antibody against the COVID virus, SARS-CoV-2. And low levels are not as good as high levels. I mean, that's the simplistic way of looking at it. And in the group of women that had only had those first 2 doses, their vaccine titer, and these are measured in a unit, was 674. And those that had had 3 or more doses was 8,159. That's over a 10-fold difference. So that's really, really significant. And so it's just another piece of evidence that we have to suggest that, especially for pregnant women, it'll be much safer for you and your baby if you have at least 3 or more vaccines in you. Then the second study is from Nature Communications, and it was looking at the infants actually born to these mothers who had COVID during pregnancy. And 221 participants, pregnant participants, and 227 COVID-exposed fetuses. They get enrolled in a longitudinal cohort, so they're followed over time. And what they found was that 150 of these mothers were unvaccinated, and that 23 experiencing severe or critical disease were only 3 or 4% of the vaccinated mothers experienced severe or clinical disease. So there's actually a 4-fold difference. So it goes from 16% to 4% in the difference between those unvaccinated and those vaccinated. And then they look at the infants, and the odds of the infants developing severe respiratory distress was 3-fold higher in the infants born to mothers who were unvaccinated. That's dramatic, because when a kid, that little neonate, just born, respiratory conditions are really, really serious problems. And nobody likes to see a baby in distress in a neonatal ICU or whatever. So it's just more data showing that the mothers can protect themselves from problems, and they can protect the babies if they are vaccinated properly.
Mm-hmm. And as you said, there's just nothing worse than there being a sick baby. I think we can all agree that that's something we would never wish upon anyone and never wish to see. So really hoping that, people can get their vaccinations, keep themselves safe and their children safe if they are pregnant. But we had a very new, interesting story come out of the New England Journal of Medicine, as Dr. Murphy has previously noted, one of the best, if not the, best academic scientific paper in the United States, published a story on a new antiviral similar to Paxlovid, but not the same. Could you tell us a little bit about those results?
Okay, this is a study from China, and the fact that it's in the New England Journal of Medicine is really pretty remarkable. They did a very big study with 1,200 participants at 35 sites in China, and they made their own version of Paxlovid because they don't get the Paxlovid over there. It's too expensive, and they made their own. And it's called Simnotrelvir with ritonavir. So it's that double combination, just like Paxlovid. It worked just the same in the test tube, and they made the pills, and they did this big, what we call phase 3 study. And they found that the people that got the treatment versus placebo significantly shortened the time to the resolution of their illness. So they went from 216 hours to 180 hours. So they dropped, a day and a half, basically, of symptoms. And they also looked at the amount of virus that they could measure in them, and they found that that was also significantly decreased in the people who took it. Now, that's an antiviral drug, so that's not surprising. So adverse events were similar, 17% in the treatment group and 10% in the placebo group. But nothing really unusual. Remember, the treatment is really short. It's only 5 days. So anyhow, I think the important point is there's another drug out there. It's going to be used in China. China will export it everywhere. And most likely it's going to be a lot cheaper than Paxlovid. Whether or not this gets back into the United States or not and competes against Paxlovid remains to be seen. They have to go through all the appropriate approvals with the FDA. But the fact that the key results are published in our top journal in the United States is nothing short of remarkable.
Very much so. And switching over to the Paxlovid side, there was a study in the Journal of Medical Virology that published research that Paxlovid may not reduce the risk for long COVID. Not talking about the acute phase, we know that works, but can you break down these long COVID findings and also tell us a little bit about the study itself?
Yeah, so the reason I wanted to talk about this study today is because people will hear the title of the story and they'll just say, oh, Paxlovid doesn't reduce long COVID. Because one of the big pushes to give COVID is that people have less long COVID. So this was a study from University of California, San Francisco researchers, and 1,611 eligible individuals. And they sent them a survey. So they got a survey and they completed the survey and turned it back in. So surveys can be very helpful, but they're not really a clinical study. Like what we've reported in the past is results from the Veterans Administration and Kaiser Permanente, the big healthcare organization in the United States. And those people, and we also reported with, I think, the French, they have centralized databases, and they know when people come in for a problem or whatever, it's all centrally documented, everybody. And when you look at it that way, long COVID is decreased. Long COVID is hard to diagnose in the first place, but the symptoms of long COVID, fatigue and brain fog and all that everything kind of was lower in the Paxlovid group versus non-Paxlovid groups. And they can do all the controls in their database. So that's a lot better study than this survey. This survey, I think, is, the data are what the data are. But you have to keep in mind that these surveys have inherent biases and can be flawed. I don't doubt it, but a lot of people didn't return the survay.
Yes, that's very true. There were
improved, or you just don't know. It's not as well controlled as the other studies that we talked about. So I think it's kind of interest, but I wanted to bring it up because people may hear it and think, oh yeah, no, it doesn't help long COVID. That's not true.
Absolutely. And to bring more context to that, you did say there was about 1,600 respondents to the survey. The survey was sent out to about twice that number of people, maybe a little bit larger, plus or minus a few percent, but that does present a selection bias, as you noted.
Yeah, half the people didn't even return it.
Mm-hmm. And lastly, today, we spoke last week quickly about some measles cases that have been popping up in the United States. We're doing a quick update on that today. Can you just break down the current statuses of those outbreaks and if there are any new cases we should know about?
Yeah, so there was this outbreak in Philadelphia, unvaccinated people that then didn't stay in quarantine and infected other people. So that was one. And then there was a second one in Washington State. And so there's been two of these outbreaks. And the CDC is just saying, just be vigilant, be up to date with your vaccines, be careful about people coming back from countries where vaccination rates are not very high, in low and middle income countries, because they may have gotten it if they're not vaccinated themselves. And so it just is saying, we're having these outbreaks, watch out for more of them, and you should get vaccinated because one dose of this vaccine is actually pretty effective.
Mhm. And from my understanding, those cases in Washington were all among unvaccinated adults. Is that correct?
I believe so.
Alrighty. Well, everyone, please keep your eyes out if you fear you may have symptoms from measles. Remember, stay home. Call your healthcare provider. They will provide you with any
If you think you
instruction and
have
help.
measles, don't bring them in the emergency room of the doctor's office. Call the doctor's office. Tell them what you think. Rash and spots in the mouth, and let them work with you from there rather than just bringing that person in because it's highly contagious. You could contaminate a whole waiting area.
Absolutely. And on that note, a rather sad one. However, thank you, Dr. Murphy, for both your time and your expertise, answering our questions, reacting to the headlines, and breaking down the statistics. It's much appreciated.
Well, thank you.
And thank you all for joining us this week. We hope to see you again next week. And as always, if you have any questions, please feel free to submit them down in the comments below or at any of our social media linked in the description. Thank you and have a great weekend, everyone.
Take care.